temporal bone fissures. That is the frontal view, the entire temporal bone. Four intrinsic fissures form at the fusion lines of the four embryonic bones that form the temporal bone. Let us have a look at the four temporal bone fissures. The petrosquamous fissure. The petrosquamous fissure or suture connects the petrous and the squamous bone. It opens directly into the mastoid antrum. It is a narrow fissure and continuous with the petrotympanic fissure. The petrosquamous fissure. The external petrosquamous fissure, which links the squamous and petrous part of the mastoid process, sometimes is visible on the outer surface of the mastoid process. The internal petrosquamous fissure is located in the tegmen tympani and joins the squamous and petrous portions. This is where the petrous part of the temporal bone, and the squamous, the petrosquamous suture. Again, transverse CT of the right temporal bone of a child with hereditary cleidocranial dysostosis. Now here we find a prominent petrosquamous suture, and this could be misinterpreted as a temporal bone fracture. Tympanomastoid fissure. The tympanomastoid fissure anchors the tympanic bone to the mastoid process. This suture is situated in the posterior-inferior part of the external auditory canal. The auricular branch of vagus, Arnold's nerve, emerges through the tympanomastoid suture to innervate part of the external auditory canal skin. This is the tympanomastoid suture between the tympanic bone and the mastoid process, the tympanomastoid fissure. This is the squamous, the tympanic, the mastoid parts of the temporal bone, the zygomatic process, and here between the squamous part of the temporal bone and the mastoid is the tympanomastoid fissure. Between the tympanic and the squamous part of the temporal bone is the tympanosquamous fissure. The tympanosquamous fissure, the tympanomastoid fissure here. The tympanosquamous fissure connects the tympanic bone to the squamous bone. The tympanosquamous fissure is seen in the anterosuperior part of the external auditory canal and continues medially into the petrotympanic and petrosquamous fissures. This is the tympanosquamous fissure. Between the tympanic part of the temporal bone and the squamous part is the tympanosquamous fissure. CT of the left ear showing three different sutures appearing with a Y shape. They form the Glaserian fissure. Number 1 is the tympanosquamous fissure. Number 2 here is the anterior petrosquamous fissure, and the posterior petrotympanic fissure. The petrotympanic fissure or the Glaserian fissure is situated between the medial aspect of the tympanic bone and the mandibular fossa. It transmits the cauda tympani, the anterior tympanic artery, and the anterior malleal ligament. The petro Number 3, the posterior petrotympanic fissure. The petrotympanic fissure. Now, what is the clinical pearl in all this? In the context of trauma, these normal fissures, especially if evident, may be misinterpreted as temporal bone fractures. Study these fissures very well so you have an in-depth knowledge about the 4 fissures in the temporal bone. The petrosquamous fissure may remain open until the age of 20, providing a route for the spread of infection from the middle ear to the intracranial cavity. Fissures of the temporal bone.